On today's World Insight, we've put the coronavirus under the microscope. Can we identify the intermediate animal host of COVID-19?
So that strongly suggests that there is a wild animal fat reservoir for this lineage of the beta coronavirus also.
And adapting to life indoors, how can we make the most of life at home? Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. The spread of new coronavirus cases across the globe underlined the continued risk of a worldwide pandemic. Let's take a look at the situation in the United States as well. Late Wednesday, CDC officials confirmed the first case unrelated to previous cases. Despite the rising number of infections, U.S. President Donald Trump says the risk of a widespread outbreak is, in his words, very low in his country. He also put Vice President Mike Pence in charge of the national response, though. Trump defended his administration's handling of the crisis, saying public health officials were ready, willing, and able to move quickly if the virus spreads. However, some of the hearings on Capitol Hill suggest otherwise. So, do experts evaluate the current situation well? Earlier, I talked to Linda Safe, who's a distinguished university professor at the Ohio State University in the Food Animal Health Research Program and the Veterinary Preventive Medicine Department. Let's listen in. For more, joining us from the United States in Worcester is Dr. Linda Safe, distinguished professor at Ohio State University in the Food Animal Health Research Program and also Veterinary Preventive Medicine Department. Professor Safe, welcome to our program.
Thank you. Thank you very much for inviting me.
I understand you're joining us from a small studio where you are based, but I can still see you quite clearly. So, Professor Safe, I want to start by asking you about the latest situation in the United States. Tell me more about your assessment.
Well, I would follow the same scenario that CDC posed, that right now the risk is low, but it's quite possible we will have community-acquired cases here in the U.S., like we're seeing now in Italy and South Korea, so that we need to be prepared. And in a statement from CDC, they indicated that it's likely not to be if, but when. So I think they're just advising everyone to be prepared, for the public to be prepared, so that it isn't a shock if we have other cases now appearing in the U.S.
Professor Safe, if I could, asking you about the sources of the virus for the U.S. right now. If you look at the latest cases, what are the origin of the virus, if you can, and also what does that mean for prevention and control measures the U.S. should take?
So right now, the origin has been either a connection with individuals who came from China or had contact with Chinese cases or cases in Asia, as well as the majority of the cases that came back to the U.S. Were from the cruise ship that was stationed in Japan. So what's being done is to quarantine those cases, and if any of them had any contacts, to make sure those contacts are traced. So right now, the tracing is done by CDC, but it's done in collaboration with our state public health agencies. So they work very closely together in terms of coordinating everything, tracing contacts, but most of it is piloted through the U.S. CDC. The majority of the cases that came home from the ship are in isolation facilities at military bases in the U.S. And the ones that have symptomology, some of those are in the hospitals, in isolation areas.
How much prepared are the medical facilities inside the United States now? If I could use China as a relatively equivalent reference, there is a search for medical facilities at the very outbreak. So how prepared are the medical facilities inside the United States, whether it is public or private?
So the idea would be that if there are the COVID-19 cases that come into the hospitals, first of all, there's certain designated hospitals that have high levels of containment. So the first priority is that they would go into these designated hospitals that occur across the United States, and they would be then in strict isolation in the designated hospitals. Now, that worked quite well when we had the SARS cases that were in the U.S., and it also worked quite well when we had the Ebola cases that were in the U.S. So I think at least this initial level, these cases are pretty much being isolated within restricted hospitals.
Right. According to the U.S. CDC, the flu and the novel coronavirus share similar symptoms, such as fever, cough, and shortness of breath. Some even suspect that among the thousands of people that have calmed down with the flu, a big proportion could be, in fact, COVID-19 patients. I asked Linda what to make of these suspicions and even rumors.
Yeah, so I think that in many cases now, it's recognized that there are diagnostics for the flu. So many of these cases were tested with flu diagnostics. So what the CDC is now proposing is that we will take a subset of patients that tested negative for the flu, but had respiratory symptoms, to make sure that we do test those for the COVID-19, the SARS coronavirus 2.
But what about the deaths that already occurred as a result of what we believe now as the flu in the United States? How much can we track back to the records of those patients to find out whether there's any specific link to COVID-19?
So I imagine, although I'm not privy to this information, I imagine the CDC has ways to track back if there are any suspects there. And there may have been retained tissue in some cases, or samples that could be retrospectively tested if need be. But for now, there's no evidence that these are anything outside of the flu. I think it's probably the same case in China, that the flu every year is underestimated. And the flu can kill anywhere from 12,000 to 61,000 individuals in the U.S. annually, and millions worldwide. So that's something that we need to keep in perspective when we compare the COVID-19 versus the flu. The flu is still a major killer.
Professor Saif, one of the difficulties for all of us to work on COVID-19 is because many of the symptoms of COVID-19 patients are very similar to the flu patients. Do you think now the test kits used in your country and also in the other parts of the world, as a virologist, when I ask you this question, whether are eloquent or efficient in helping us to find out about the realities of COVID-19?
As far as I've heard, the test is working very well at CDC. Certainly, as we have more cases, if the test needs to be revised for sensitivity or specificity, that will be done. But right now, what I like to explain is that the cases for influenza are being tested for diagnosis of influenza.
Mm-hmm.
So the suspect cases to look into would be the ones that test negative for influenza.
Mm-hmm.
And I understand that's how you also were doing the testing in China, that you were also doing a differential test. The test was working very well at CDC, and they were not having problems. But part of the surge capacity to deal with this virus is to also make those kits available to the state diagnostic labs. So when some of them were sent to the state diagnostic labs, what I understand is that some of them did not perform as well as they should have, but only in certain state labs. And then in the meantime, CDC was the one that was still in charge of testing all the samples. So they were just preparing the state labs to be sure that they could run the test and have accurate test results. But the state labs at that time were not doing any of the official testing. That was still all being done at CDC. So that was the first distribution of the kits, and since then those kits have been reformatted to make sure that each of the state diagnostic labs can run all the tests and with the reagents, and the results are reliable. And that's always, the quality control is always with CDC.
Professor Saif, a lot of people in the U.S., as a result of the latest growing number of confirmed cases, have been asking whether they should also do tests, even if they do not have any symptom. As we know, there is an asymptomatic period. The incubation sometimes, it could be very long, and that is very dangerous, according to the experience that we had already here in China. So will those test kits be available to the public for just general tests? Do you think that is a good idea?
No. No. I don't think we have any test that would be simple enough and the analysis simple enough to be provided to the public. Those tests really need to be done at public health facilities and the CDC. And as a virologist who works with these kinds of diagnostic tests, I can tell you that they need experts to be able to run the test with all the controls and interpret the results.
Lately, the Lancet Journal released an article in support of the scientists, public health professionals, and medical professionals of China combating COVID-19. It says the rapid, open, and transparent sharing of data on this outbreak is now being threatened by rumors and misinformation around its origin. It says also that we stand together to strongly condemn conspiracy theories suggesting that COVID-19 does not have a natural origin. Among those who have been contributing to that article is Linda Saif. She is joining us in this interview and telling us exactly what she meant in that statement. Let's listen. You, together with some of the other scholars around the world, put out an open letter in Lancet suggesting that the rumor about the so-called virus of COVID-19 was originally, quote, developed in the lab was groundless. Could you tell us more about how you come to this conclusion and why you and the other experts decided to write this open letter? Why is it crucial today?
Yes. So not just myself, but others have looked at the genome sequence of the COVID-19. And just like SARS and MERS, there was a precedent for these types of viruses spilling over from a host reservoir in bats. And that appears to be true for SARS and for MERS. And then likely for COVID-19 because there was a bat sequence published that was about 96% identity with the COVID-19 SARS coronavirus 2. So that strongly suggests that there is a wild animal bat reservoir for this lineage of the beta coronavirus also. So we know from past experience and historically that these are not the first coronavirus that spilled over from animals to humans. If we look back at sequence data, we can also see evidence of the spillover in some cases from ruminant species of several of the common cold coronaviruses that now circulate endemically in humans and cause the common cold. So this spillover from wildlife to humans for coronavirus is not unprecedented, and we also know that this happens within other species too. There are interspecies transmission, and I worked on some of that within wild ruminants and cattle to show that there was spillover. So when we look at the genome, we see that this virus that infected humans and transmits human to human is still not identical to the bat coronavirus, and in fact the spike of this virus, the sequence for the spike, is quite different between the bat strain, although the rest of the genome is similar, and the human strain. And what we see in the spike is that there are differences, that this new spike that's now in this new emerged coronavirus that's in humans has acquired a new set of mutations that actually allow it to bind to the receptor protein, the ACE2, in a different way that we didn't expect and we couldn't have predicted based on SARS. So it would be almost impossible to engineer something like that without pre-knowledge that you can have another configuration like that to have high affinity to the receptor. Another difference is that this virus also has a cleavage site, a protease cleavage site, furin protease cleavage site that is not present in SARS. Also, there are random mutations throughout this genome. And if this were an engineered virus or a spillover from the lab, we would usually see a common backbone, or we would see profiles consistent with the laboratory strains. We don't see any of that. So this made us conclude as scientists, many of us who have studied coronavirus for a long time, that the most likely source for this was a spillover event, maybe initially in bats, but the unknown question that I think is still critical to answer is, was there an intermediate animal host that harbors a virus that is more similar to this human strain even than the bat virus? And the reason we ask that is because we know for SARS it was civet cats. And one way that SARS was eliminated in China was both your strict quarantine measures, but also the slaughter of the civet cats in the marketplace. And after that, the SARS epidemic ended. For MERS, we know that camels, dromedary camels, are the intermediate host, likely spilled over from bats to camels to humans. So there's a lot of precedent that there's also an intermediate host for the COVID-19 SARS coronavirus too. Professor, and it's critical to know what that is, because for all we know, these spillover events, some of them can still be occurring in animals, from animals to humans.
Professor, if I can, according to some latest research already suggesting a huge possibility that this is coming from pangolin, tell me from a virologist perspective, do you see this could be a possible explanation?
So what I have read, because unfortunately that paper has not yet been published to see the sequence data, the full sequence data. But what I've read and heard from others who study the sequence closely is that the pangolin virus, what's available so far, the spike is very similar to the human COVID-19 SARS coronavirus 2, but the rest of the genome shows more variation. So because you still don't have such a high degree of identity across both the spike and the whole genome, that may not be the intermediate host, but it could be one host that contributed to a virus that recombined with another coronavirus to produce this new human strain of coronavirus. We wouldn't call them intermediate hosts because the intermediate hosts suggest it could spill over directly from that host to humans. But they could be other strains in humans that when you have a co-infection of two strains in another species, they recombine in that species, and that's the virus that can spill over to humans. So there are still pieces of the puzzle that we need to solve here. And I think the group that can solve more of this are the Chinese scientists who study and look for these viruses in bats and also in other wildlife species, in the live animal markets in China.
Just generally speaking, coincidence could be one of the important elements in the discoveries of science. So Professor Saif, what about the factor of so-called coincidence vis-a-vis the rumor about so-called lab-produced virus?
Well, I think I stand with my previous answer. So what I've tried to do is provide a scientific, fact-based explanation for the best knowledge we have right now about coronaviruses, for the reason that many of us scientists do not believe that this was a lab-created strain. So I will stand by those arguments now unless, you know, there would be other sequence data or additional information that should be considered.
Why do we still do not know much about all of these questions? Is it normal? Can we, with the current level of scientific research capabilities, be able to speed up this process to be on time?
Okay, so that's a very good question. I want to really congratulate the Chinese scientists who sequenced this new virus within 2 weeks and released the sequence worldwide. This gave scientists across the world a chance to look at this genome sequence, and we used that genome sequence as a basis to try to create antivirals and vaccines. So without that sequence, we would be much further behind than we are now. So I know now, based on that sequence, that there are many scientists worldwide who are now working on antivirals and drugs to try to block this virus. So protease inhibitors like for HIV and repurposing some of those to try them in SARS patients. And that's all because of the sequence analysis and availability of the sequence. We need the sequence to make a vaccine that can block the spike from binding to the host receptor. So this is based on the sequence and critical. So I see these vaccines now. The first one is actually an RNA, a messenger RNA vaccine that's going into a very small pilot phase 1 clinical trial in a few patients for safety. And if it shows good safety standards, it will go into a bigger phase 2 clinical trial. And that vaccine, though, would still be about a year off. But we're making more rapid progress than we ever did with SARS, because our new vaccine platforms have been developed that are more rapid and that you can scale up for production better than conventional classical inactivated or live attenuated vaccines. And also, we now have the capability to screen and repurpose drugs because there are huge databases of drugs now that you can look for ones that you can predict by bioinformatics that could block this host receptor interaction or some phase of the virus replication, like the protease inhibitors and things like that.
Yeah.
So I would say that actually in terms of this outbreak, the progress has been pretty remarkable based on the tools that we have now. And I think we will see, maybe even before the vaccines, some antivirals, or we also have the potential now to produce humanized monoclonal antibodies that will block the spike binding to the host receptor. Those will take less time, and those would be feasible for use in clinics for treatment. And that was one of the first things that happened with SARS and also with MERS. And some of those now are, for MERS, are being tried in clinical treatments.
Yeah.
So we do have a lot of technology that we didn't have before that is making more rapid progress.
As more generations of the virus comes up, will the virus be less harmful than it used to be, which was the case in some of the previous incidents? What about this time, COVID-19?
Okay, for an RNA virus that can mutate and recombine, my answer would be very similar to trying to predict the next pandemic of influenza. It's unpredictable. Okay? We really cannot know that. We don't have enough knowledge to predict that. I think there are several possible scenarios now, based on my experience working long-term, almost 4 decades with animal coronavirus. One is that the virus will become endemic in the human population, and eventually, because you have various levels of immunity and it circulates in the human population, it essentially then becomes more like a common cold. That's one scenario. Another scenario is that the virus will stay in the human population, but the infections resolve, and maybe you only have a few clinical cases that allow it to persist in the population. And just like seasonal flu, you will have renewed outbreaks of the virus in the winter months when the virus is more stable, people are confined in smaller places, and the virus can spread more readily. And we've seen that even with some swine virus. The transmissible gastroenteritis virus in pigs would disappear over the summer months and then reappear every 2 or 3 years in outbreaks in the winter months. So all of these things are not unprecedented for coronavirus. So we're not sure what will happen. But we need to be prepared. If we think this is going to be like seasonal flu, then we need to have a vaccine for future outbreaks.
Now WHO is, Professor Saif, becoming ever closer to announce a pandemic related to COVID-19, even though it is still not using the word yet. But with the spread of the virus and the number of deaths caused in different parts of the world's continents, how fast do you think we're likely to see a more challenging situation than they were facing today?
So I think I've heard many people say, and I would agree with this, that we're on the edge or the brink of a pandemic. And this is because of these community-acquired clusters of cases now that are in other countries.
Tell me more, Dr. Saif. You were one of those on a task force to tackle with SARS 17 years ago. What exactly is your job at that time, and what do you think really makes sense from the experiences of dealing with SARS, internationally speaking, particularly from the expert's perspective?
So what the task force that I was on was related to zoonosis and spillover from animals to humans, as well as animal models for human disease. So what I learned is that we need to have integrated what we're referring to as One Health approaches to these problems of zoonosis. So you need to have both the veterinary scientists who work on the animal side and know about the different species and also have worked with animal coronaviruses, and the human medicine side and the basic researchers, as well as the public health epidemiologists, environmental scientists, as well as social scientists. When you can bring all these integrated teams together and look at the holistic situation with these new emerging viruses, I think you accomplish a lot more than working apart each separate discipline. So that's what I learned, and I hope that will also now apply to COVID-19.
Dr. Linda Safe, Distinguished Professor at the Ohio State University. Thank you so much, Dr. Safe, for joining us, and also the important info and insights you shared just now. Thank you. Welcome back. To minimize exposure during the ongoing coronavirus, many Chinese are choosing to stay at home. And although this strategy can be monotonous, some people have taken up creative pastimes and developed new skills like cooking. People are also devoting more time to health and fitness. At least we hope that is the case. Earlier, I spoke to Kate Kuei, president of the NetEase Agriculture. She joined us in her kitchen and gave us a dose of her healthy lifestyle and looking at the patterns that people are following these days when it comes to their diet in China. Let's listen. And clinician. And now I have through Skype Kate Kuei, the president of NetEase Agriculture and also founder of Hetian Flying Chicken Agriculture Technology Limited. What a pleasure to see you, Kate.
Thank you, Joy.
Tell me about the latest boom for online sales of poultry, because you've been trying that for the past few years, and now it's a very different state. Tell me more about that as a result of this desire to have more food delivered for home.
Right. Out of this unexpected crisis, online fresh produce e-commerce sites actually, their average order, daily order, actually surged about 3 to 5 times. As one of the suppliers on the platform, of course, our orders surged accordingly. But those are not the most important thing. The most important thing behind such surge actually are 3 factors. First of all, is customer habits. To purchase fresh produce online has already been formed. Forming customer habits actually takes a very long time usually and very costly. However, during this period of time, during this crisis, unexpectedly, customer habits have formed. The other very important thing is actually ticket size has stayed. Previously, people or customers, they go online shopping, they'll compare about the price on top of the quality. But now, during the crisis time, as long as all these food delivery can arrive your doorstep on time, people are already very grateful. So once customer habits are formed, the ticket size stayed, the brand awareness is also built. So we actually predict after the crisis, or when the virus is tapering off, frankly speaking, the trend will still stay. So these are the most important things behind observation.
Right. But on the other hand, we have seen people also trying to buy online ready-made food coming from some of the biggest restaurants, you know, some of the very well-known big names. So how do you see people's desire for fresh produce from providers such as yours and vis-a-vis the ready-made food coming from the big name restaurants? Kate.
I think these two are complementary, so to speak. For people who actually love cooking, like myself and a lot of my friends, they would actually just purchase all those online fresh foods online because it's so convenient right now. But for someone who doesn't really have time and very busy working, or they just simply don't want to cook, they can just buy a lot of prepared food. Michelin star hotel, Black Pearl restaurants, which are the ones that we will have to, book the reservation very long time ago, or just queue in front of the restaurant to wait for a seat. Now they actually delivered or developed a very fancy takeout menu. So with such takeout menu, we can actually taste all these fancy, delicious food at home, at your doorstep. Previously, don't really care because the in-restaurant dining is already sufficient for their income, and they're busy enough. But now, with the crisis, adjusted their business model a little bit, which actually benefits customers.
But how do you see, people's consumption of meat? Here I'm talking about red meat, white meat, including poultry, for example, that you are offering, have been changing in terms of a percentage balance as a result of the latest incident. Is there much change? Is there much change in taste and interests about the food?
I don't think the crisis itself will change the percentage of the composition of Chinese people's food because, for instance, pork. Most Chinese people eat pork, and this is a dominant eating habit for most of Chinese Han people. So I don't think this will change along with the crisis. We do have the pork shortage in terms of supply right now, but in terms of the customer habits, it stays. In terms of poultry supply, it's the same. Those are most important protein for Chinese people. So Chinese people will still have to rely on the pork and chicken, so-called white meat, as their daily protein intakes.
And my next question, Kate, has a lot to do with how would you guarantee, providers like you, the quality of the product, particularly right now, people are so concerned about the healthy eating and also the quality of meat because, after all, we still do not know exactly where the virus comes from. People want to be guaranteed 100% safety.
So when we select our site as the starting point, it has to be very far away from the residential area. So that actually prevents us from being contaminated if such kind of epidemic happens. But luckily, so far, there is no such kind of outbreak, even in the county where our farms are located.
But there's one thing, that is the shortage of labor. As we know, it is a reality now.
As I mentioned, because all our farms are located in areas very far away from the residential area, and they're located in the county where there is no virus outbreak. So for us, the return to work process is a lot easier. We had a gradual return to work process started in January already. So using chicken as an example, we guaranteed almost all the yellow feather chicken supply in Fujian province. This is also something very crucial and important, for Fujian citizens. But in terms of nationwide, this is going to be a problem because we understand that in some provinces, the situation is not that optimistic. However, I think gradually, when the resume to work process continues, as well as the virus is tapering off, the situation will change in the next half of the year.
Yeah. Kate Kui.
Thank you.
Thank you. Really appreciate it. Be healthy. Thank you.
Yeah.
And that's all we have for today. If you'd like to see more, try to find us World Inside CGTN into your search engine. Also find us on YouTube channel as well as Twitter and Facebook accounts of World Inside. I'm Tian Wei on behalf of the team. Thanks for watching. Bye for now.